care system in Kenya has undergone substantial developments, experiencing both successes and challenges. As the country commemorates its 60th anniversary, our health and science reporter Zainab Mohammed engaged in discussions with two senior health workers, drawing from their experiences as they shared insights into the past, present and the future of the healthcare sector in Kenya.
Both Dr. Jane Wakahe, a public health specialist, and Boniface Mrashui, a retired nurse, worked as health practitioners back in the 1970s and 1980s.
My first posting was into Nakuru General Hospital, and that was a long time ago. The Nyayo wards were not yet built, so I was there as they were built in the 79s there.
I qualified in 1986 June. Thereafter, I was posted to Moi Hospital. Then it was just a district hospital. According
to them, despite the fact that technology was scarce back then, the health services offered to patients was top-notch.
There was a calling about being medical people then. The nurses were very kind, the doctors were very kind. We were few, and the patients were few. We almost knew every patient by name and exactly what they were needing at that time.
The hospitals were well staffed. There was no shortage of staff. So much of the work was done by healthcare workers, and we never used even to have caretakers in the hospital. We used to handle a client from the time the patient is admitted to the time the patient is discharged.
However, the health practitioners say things began changing gradually as the patient-to-doctor ratio began widening.
As time went by, we started experiencing staff shortages. Those who are retiring were not being hired or being replaced with enough new staff. So much of the time, we found that eventually the staff are overwhelmed.
Sometimes we would find ourselves, we have 3 patients in a bed. Like, for example, in the maternity unit, you'd find 3 mothers who have delivered. And I remember one of my colleagues one day asking, which of these 3 have I just examined? You know, because there are 3 sleeping like this on the same bed.
The conditions continued to deteriorate as days went by, with many public hospitals lacking essential commodities such as medicine.
I remember, in fact, like towards 1982 there, we sometimes had to ask the pharmacy what medicine they have, because then, so that we can prescribe, which was very, very odd because the Kenyatta had left, everything was running like perfectly.
Slowly, the practitioners say the healthcare landscape changed, with the private sector offering better quality of healthcare services as compared to the public sector.
I would come to this hospital, I would go to Mpisha, I would go to Aga Khan, and then I would still be in Kenyatta National Hospital. And I was kind of unable to marry the two. Here I come and prescribe whatever I want, get whatever the patient needs. You know, I don't have to think twice. And then there is like, what is there?
The onset of the devolution of healthcare witnessed a shift in health services toward local communities. Nevertheless, the practitioners argue that devolution fell short of its objective, as numerous newly constructed facilities lack the essential resources to function effectively.
Facilities are closer to people now. Almost in every village you'll find facilities, healthcare facilities. Unfortunately, in those healthcare facilities are just buildings. They don't have medication. They are not stocked. So much of the time you find those are kind of a white elephant because they don't serve the intended purpose.
60 years down the line, there's also a lot to celebrate with the eradication of diseases such as polio and measles.
It's universal vaccination. It's become very good. The health status, the awareness of what should be done, and people have accepted vaccinations, and people know that they need to go to hospital, not to depend on other things. So it's very rare. You will not see a child now die of measles. I've seen children die of measles long ago, and they are so sick, and the mothers in the village are looking for soil from from what moles have dug up and then smearing their children to get better. And of course they would die. So that is gone. We are way ahead.
Kenya has also become a medical tourism destination with the advent of various specialized services across the country. Going forward, the health specialists say the country's move towards promotive and preventive healthcare services is a step towards the right direction. Therefore, its successful implementation should be prioritized. Zainab Mohammed, TV47.